All right. Hello, friends. Welcome to our bonus video episode only on YouTube. So like and subscribe. And Tom, I think you have a question that we want to ask.
Yeah. So we've got Dr. Alin Gragossian here with us, and she has great experience on both sides of the table. If you listen to the podcast, you know that. And so she has a really unique perspective in kind of being able to help patients navigate from both sides of the fence. So yeah, I mean, I know that when you're in critical condition, when you're hospitalized, and even if you're dying, you have a lot of different teams working on you. And I know it can be kind of tricky to translate that and navigate people giving you all these different messages. So what are some tips you have for some folks on that?
Sure. So when I was a patient, I realized, as a patient doctor, I had kind of a different experience because I generally knew a little bit more about what was going on. So for example, when I was in the ICU as a patient, I had several teams that were taking care of me. I was in a cardiac ICU, so I had the cardiac ICU team. I had a cardiologist following me. I had a surgical team following me, like the cardiothoracic surgery team, and then like a few others too. So, and my parents were with me. My parents, who are not in medicine, and they were always confused as to why they were getting different messages from all the different doctors that were seeing me. So for example, the ICU team would come in and they would say something like, "She's fine," and they would leave. And then the cardiology team would come in and they would say something like, "She's still in heart failure, she needs a heart transplant." And then, my parents were just always like, "Why is the ICU team saying that you're fine, but this cardiology team is saying that you still need a heart transplant?" And what I try to tell people, or what I told my parents then at least, was every team, every doctor, every nurse has a different goal for you. So you have to realize that the ICU team, their goal is to stabilize you. So as long as your vital signs were fine overnight, you didn't require extra medication, you didn't die, everything was stable throughout the night, you're considered fine in their eyes. As long as, but for the cardiology team, I'm still in like fulminant heart failure, so I'm still going to need that heart transplant. And so I'm not fine, and from that perspective. And then from a surgical team, like, they're just going to operate on me. So all they care about is me being optimized for surgery. So they want to make sure I'm fed. They want to make sure I'm doing PT. They want to make sure I'm doing this. And so, from being a doctor, like, I knew that, but I can only imagine how difficult it would be if you're a patient for the first time and you don't know that and getting all these different mixed messages. So I tell people to always advocate for themselves, to always ask what each team's goal is, to get, if anything, sometimes it's easier to just have one person, come in with a final plan of the day, or talk to, let's say, whoever's running the unit, whether it's like a resident or a doctor or a nurse, whoever it is, that you want to just be the point person that tells you like, this is going to be the plan for the day. If that's easier on you, or, just advocate. I tell people, if you're a patient or, family member of a patient, you can ask things. It's totally okay. I know things look intimidating and sound intimidating, but ultimately it's, your life on the line. So we do a lot of things on the medical side that is very confusing. And again, even having known all that, at times I was confused. So I can only imagine how much more difficult it is for patients. So that's my tip for everyone.
Thank you. And if there is, if you're having a hard time putting the pieces together, is there one person that you can kind of be like, okay, can I ask for this person so they can kind of give me an overview of what's going on? Who would that person be?
Usually, like, if a patient is really critically ill, usually, and every hospital is different, but there's an ICU team that is going to be like the head that kind of takes what all the consultants are doing and whatever recommendations they have, puts everything together and manages the patient. So there's always going to be an ICU doctor, ICU nurse, ICU like resident fellow, whoever it is. And you can always designate that person or ask that person. but again, every hospital is a little bit different, so I don't want to say that about every hospital. But for the most part, you can just ask as well, like, who is one person I can speak to at the end of the day about my so-and-so's plan or my plan.
Awesome. All right, thank you so much. Thanks for all your time. Such a fun conversation and beautiful conversation. You're the best. Thank you.
Thank you so much, guys.
Thank you.
See you next time, everybody.
See ya.